Hello and welcome. Good morning, good afternoon, or good evening, depending upon where you are watching in the world. Thank you for joining us today for this IHEAM and HEVMA Developing the Healthcare EFM Workforce joint webinar. My name is Paul Fenton and I'm the President of IHEAM and Director of Estates and Facilities at East Suffolk and North Essex NHS Foundation Trust. Today's webinar will be presented by Prana Izar, Chief People Officer for NHS England and NHS Improvement, Jonathan Stewart, HEFMA National Chairman, Pete Sellers, the Chief Executive of IHEAM. The title of today's presentation is the National Policy Perspective, and we'll kick off one of 3 sessions that we'll be running today. We'll be using the questions function to take questions from the audience. This can be found in the top right-hand side of your screen and is the icon with a question mark in a speech bubble. We won't have time to use the audience hands up facility, so please post your question to the organizer and our speakers will answer as many questions as there are time for at the end of the session. Unfortunately, Prana is unable to stay with us for the question session at the end, but she has promised that she will answer any questions that you may have, and we will post those back onto the website and forward those to you. Please note that a certificate of attendance will be sent to all of those who watch this live webinar in its entirety today. We request that no part of this webinar is reproduced and published in print or any other format. And lastly, I would now like to hand over to Prana for the start of the presentation. Prana.
Thank you very much. Thank you for inviting me today. It's a pleasure to be invited back to talk to you once again. I was really keen, so I'm leading the response, NHS response to the India crisis, and I also have family in India and extended family and friends. But I was really keen, even though the day has been, the week has become incredibly compacted and busy, I was really keen not to drop out of this event because it's this group of people and this function is really, really important in terms of what the NHS has to deliver. As we reflect, we know that this last year has been an unprecedented year. I think that's the word of the year, is unprecedented for the whole planet, but especially for all NHS staff. And this has especially been true for all of you, our estates and facilities staff. You're at the very forefront of our NHS. You are the colleagues who greet us at reception, provide food and drink to keep us going, take us and our loved ones safely between appointments, make sure that the buildings that we're in are safe and appropriate for providing care. Your roles are absolutely vital. And this fact has only been reinforced by the pandemic. During COVID, you have provided essential support to patient care, whether by ensuring that the wards are safe or making sure life-saving equipment functions. The building of the Nightingale hospitals, for instance, at such pace was a testament to the incredible work you do. And in fact, one of the requests from the Indian government is to share our expertise on setting up Nightingale hospitals. And that's, again, you are part of that success. And you are designing and building new facilities to give our patients the best possible care. You also play such a crucial part in our sustainability agenda, which remains a top priority for estates professionals and for the NHS. Progress has already been made to reduce the carbon footprint across the NHS estates, but we know there's much further to go, as set out in our Greener NHS strategy. If you haven't read it, please do. It's really exciting and something that I'm very proud that the NHS is leading for the country. I also appreciate and want to acknowledge that estates and facilities colleagues have been massively and disproportionately affected by COVID. As a result, I've set up an estates and facilities advisory group of 27 NHS trusts, service providers and organizations representing 380 NHS directors of estates and facilities who are responsible for over 185,000 colleagues in the NHS. This group is well attended, and the colleagues share challenges, and they work with me to agree how we can improve working conditions and then really help to make it happen on the ground. One of the things I wanted to update you on was the progress and next steps for the People Plan 21-22. When we published the People Plan last July, the NHS was facing the greatest challenge in its history. COVID focused and accelerated the actions in the People Plan for the NHS to have more staff working differently in a compassionate and inclusive culture. Throughout this period of uncertainty, the 4 pillars of the People Plan gave us a common framework and clear direction, and that's really important. Responding to the extraordinary demands of the pandemic, we acted on feedback from across the NHS to identify a small number of priority actions. This made sure that our collective efforts were focused on things that made the most difference to our NHS people. So I wanted to share what our report card is so far collectively, because it's not something that I do by myself or NHS EI does. This is happening and progress happens in every conversation and every ward in every part of the NHS. But this is our collective progress against the People Plan. So the 4 pillars and some of the things that we have been able to deliver together. The first one is looking after our people, which is focused on supporting NHS colleagues to be safe and well and ensuring their voices are heard. So 1 million risk assessments to keep staff safe were carried out, including 96% of ethnic minority staff. 1 million conversations, 1 million risk assessments, 1 million ways to keep staff safe and supported. Our offers of health and well-being at the national level have been accessed over 900,000 times. A well-being guardian role has been introduced in each NHS trust at the board level because we want to elevate staff safety and support as a board responsibility. Excuse me. Delivering safe staffing of the COVID response and then the vaccination program. Over 95% of NHS staff have had their first vaccination. The second pillar of the People Plan is belonging in the NHS. 181 trusts now have disabled staff networks, and 177 trusts have ethnic minority staff networks in place. And this means that more colleagues have input into decision making. More colleagues have a way to make their voice and opinion heard. 500 fewer ethnic minority staff will go through the disciplinary process as compared to 2019. And this is a result of improvements made to close the disciplinary gap based on ethnicity. However, RES, which is the Workforce Race Equality Standard, that data shows higher levels of harassment and bullying are reported by Black, Asian, and minority ethnic staff compared to white staff. And fewer ethnic minority staff are being appointed to roles compared to white staff. This cannot continue. So we are working really hard to redesign recruitment and promotion systems and equip managers, but also hold them accountable for equality and inclusivity. The third pillar is new ways of working and delivering care. Sustaining other services with greater use of innovation, technology, and new ways of working. So for instance, extensive digital working with more than a third of staff working sometimes remotely. Flexibility and portability amplified through the introduction of workforce sharing agreements, digital staff passports, and carers passports. And this saves staff time and avoids stress. And we haven't finished yet. We're investigating how we can use apps to make it much easier for you to keep in touch with your colleagues, book leave, check payroll or payslips via mobiles, and apply for training. The fourth pillar is growing for the future because we do need more people to join the NHS. So the good news is that overall our staff numbers are growing. We are up by around 42,000 full-time equivalents across clinical groups over 12 months between November 2019 and November 2020. And retention is improving across groups as well. An additional 3,000 nurses have stayed through improved retention. The 2020 NHS staff survey showed fewer staff are thinking of leaving their organization, and more than 2/3 of staff would recommend their organization as a place to work, which is fantastic. But we still have a long way to go. Many people are exhausted from COVID. I'm sure you will understand that, and I'm sure many of us are feeling tired. And we will all need time and space and practical support to recover fully. This is why we have made the people agenda and the people plan 21-22 as the first priority in the planning guidance sent out by the chief exec of the NHS, Sir Simon Stevens, with the focus on people recovery. There is an opportunity as we move into recovery, and there's a need as well to shift our focus to the longer term. We must lock in the beneficial changes from COVID and the people plan so far, as well as sustaining recovery over the medium term. We must balance the needs of patients who have been waiting for months for elective care, especially, with staff who are quite tired. So we need to capitalize on the ability of the NHS to be bold, to think longer term, and learn from our experiences of the last 12 months. This is why we will develop a longer term strategy for 2022 for our workforce, which we will co-produce with systems, employers, and staff, and patients actually, to look at what the future of work looks like for the NHS and NHS people, and the future of healthcare. So you may be thinking, how do I, as estates and facilities professional, how do I fit in? Well, you have a huge role to play in this. Our ambition is for the NHS to be the best place to work, to be the destination for estates and facilities professionals in the UK, attracting talent across a broad range of skills, and significantly contributing to patient care and experience. To make this a reality, this ambition, and I hope that you will join me in making this ambition a reality, many of the priorities mirror those for the workforce as a whole. We need to build on progress during COVID-19, such as the emphasis on health and well-being, greater access to flexible working, and increased use of digital technology in the way we deliver services. We know that women make up 50% of the estates and facilities workforce, but just 20% of directors. And you know that the rest of the NHS is 80% women. So there is an opportunity here to make the leadership of estates and facilities profession much more representative of the broader workforce. Just 1 in 20 estates and facilities directors come from a BAME background. So we must do better to increase equality, diversity, and inclusion amongst our workforce and the estates and facilities workforce. We also know that 34% of our estates profession are approaching retirement. So we need a focus on succession planning as well as boosting recruitment and retention. I'm also keen to invest in the training and development for estates and facilities. And that's something that we will work on together. Workforce sustainability, which is how we make sure that we can all do our jobs to the best of our ability and stay well, is a huge focus for the people plan. This is ambitious for the NHS, but we know that flexible work has helped with retention in other areas and is key to being a modern employer. And flexible working doesn't only mean working from home. It means that if somebody can't do 3 long shifts, wants to do 2 long shifts and 2 short shifts, that should be possible. It means that there are individual health and well-being conversations with line managers so that we're treating people as the individuals they are. There are lots of resources available through the Leadership Academy, which is in my team. Please go on to their website and see what you would like to access in terms of investment in your career. The last thing I want to share is the vaccination update, and then I'll stop talking. The COVID-19 vaccine is an important tool in keeping us safe, along with social distancing, wearing masks, and hand washing. So I'm determined that no staff member is left behind in being able to access the vaccine. And it's important that members of our estates and facilities workforce feel confident and ready to take up their vaccine when it is their turn. I hope you will feel that you have had access to all of the information that you needed, that you are able to provide valuable feedback and insights to help us address any barriers that the estates and facilities group of colleagues may have to taking up the vaccine. So I have a couple of requests for you before I close. Please consider the offers of training that I've just shared. Go to the Leadership Academy website and encourage your colleagues as well to look into what is available. And let's develop our skills and those with high potential to become future NHS leaders. And I hope that you will be vocal advocates of working in the NHS as a proud ambassador. A large part of recovery is taking care of yourselves, and I hope that each of you take the time to look after your own health and well-being, as well as those you work with. And please have a look at all of the support available on our website, NHS England, supporting our NHS people. As I said, this support has been accessed more than 900,000 times. It ranges from health and well-being apps to bereavement counselling to financial advice, counseling to text messaging service for support to helpline, which is managed by the Samaritans. It's really proven to be very helpful for people who need support. So please do that. So my ask of you is, make sure that your oxygen mask is on first. And the last thing to say is I'm incredibly thankful for all of your work and your commitment and your dedication. And I really look forward to continuing to work together as part of the Estates and Facilities Advisory Group. Thank you again for everything you do and for inviting me to be part of your event today. And this event, I'm sure, is going to be brilliant for the rest of the day. Thank you so much.
Thank you, Prerna, and I know that you can't stay with us for the questions, but we'll send those through to you. And a really interesting point there as well. And obviously today is in fact the 12th of May. Today is the Global Facilities Management Day, with this year's theme of celebrating FM standing tall beyond the pandemic. I think some really interesting points you made there, Prerna, with regards to people's training and development in a post-COVID world, and certainly we're looking forward to our members and all that we interact with taking up the offer of training and looking at the Leadership Academy. So many thanks, Prerna, for your time today, and we'll send you those questions and look forward to the responses. And at this point, I will hand over to Jonathan Stewart and Pete Sellers to introduce the workforce strategy. Thank you.
Thank you.
Good morning. Thanks very much, Paul. As Paul said, I'm Jonathan Stewart. I'm the chair of HEFMA. We're delighted to be working together with IHEAM on this strategy, which I'm going to take you through a little bit about what the strategy says and what it means, and then Pete will tell you a little bit about some of the practical initiatives that we've already got underway. We were delighted to have Prerna speak this morning, and I think it's really sort of underpinned the importance of what we're doing, and I hope you will see that the strategy actually really underpins the 4 pillars of the people plan that she's just described, and it's clear to me from all of this that we are pushing at an open door with regard to the NHS and the workforce, but we've got a lot of work to do. So we are here to support the NHS, the wider healthcare and social care world, and make a difference, we hope, to all of your careers. So Gemma, if you can just give me my first slide. Thank you very much. So I just wanted to start by talking a little bit about the workforce. We've mentioned quite a lot of these things along the way, but it's important to understand what we're working with, really. NHS E&I Estates and Facilities team did a survey of the NHS workforce, the Estates and Facilities workforce in about 2019. I think it was published in 2019 anyway. And they identified, or you identified as people working in the NHS, that there were about 300 identified roles across the states and facilities. It's a huge diversity of work we do. At HEFMA, we did a little bit of work during the course of the last few months and identified about 90 standard job roles. Quite often these are amalgamated, split up, or renamed, but we think there are about 90 standard job roles across that workforce. And as I think Prerna mentioned, the workforce is around 100,000 staff working in estates and facilities, which is not far off 10% of the NHS workforce. So we're a significant employee group. In that survey in 2019, approximately 27% of the workforce was contracted out. So that's working with our various supply chains or working in our PFI providers. But we consider them all to be employees of the NHS. And the workforce is split about 15% into the hard FM, the estates roles typically, and 77% across the soft FM hotel services, as might have been called, and 7% in the management and support leadership roles. So that's the sort of the makeup. And now the next slide, please, Gemma. So why did we feel the need to bring out a sort of a joint strategy? Why did we feel the need to make change? I think it's probably fairly self-evident. There's been a very long-standing issue of workforce sustainability. I think those of us that have worked in the NHS for a long while will be well aware that a lot of us were moving towards our retirement ages, and we were seeing less and less young people coming in, less and less new people coming in from university, from other professions, and we are now in a situation where it might be argued the situation is critical. As I mentioned, 34% of us, this is from the survey that NHS E&I did, 34% of colleagues in estates and facilities are now or were at that point over the age of 56. Maybe that's worsened slightly. So in the sort of the latter stages of careers, and 75% were over the age of 40. So that really highlights how many people in the younger age groups that we've actually got coming in. 50% of the workforce was identified as female, which may on the face of it seem like a reasonably balanced position, but only 20% of those were reflected in senior positions in estates and facilities, which is clearly significant underrepresentation. And as Prerna said as well, I think only 23% of the workforce is from a BAME background, but only 5 of those are represented in leadership. So we have a lot of work to do on diversity. There were at the time 4,400 vacant posts identified. So there's a huge issue of recruiting substantively into the NHS there, and 2,719 were identified as agency or bank staff. So again, the big question marks around how we're recruiting and how we're retaining people. Next slide, please, Gemma. We recognised a long while ago that all of us as professional associations, and indeed the NHS and lots of other bodies, work far better together in partnerships than on our own. This is a huge task to deal with, and we can certainly achieve a great deal more working together. So for a lot of years now, IHEM and HEFMA have had a close working relationship. We started developing our workforce plans together in about 2016, I think, after both organisations had worked on their own strategies and identified that workforce was a key element of them. It's been a tough road, I think, but we've begun to make some real headway. And we really refreshed that view that we needed to really sort of develop this workforce plan during the course of the last year. We also have, I think it's fair to say, a memorandum of understanding. This is HEFMA particularly, a memorandum of understanding with the Hospital Caterers Association and the Association of Healthcare Cleaning Professionals. So we are all jointly of the same mind on this approach. So all 4 of the professional associations, principal professional associations representing NHS staff, are committed to this process. And we've also worked strongly with NHS E&I on this, and in 2019 we announced that we were all working collectively towards the same end. We've strengthened our relationship and I think our communication channels with NHS E&I over the last year or so as well, with the national E&F team, and we are committed to continuing to do that. We've also developed relationships with other parts of the NHS and the support chain that goes with it. So we've been working with the NHS People Directorate, with Prainer's team. We're part of the NHS E&F round table that Prainer chairs, which we're delighted to be at the inaugural one and to speak at. We've worked with Health Education England. We are working with NHS employers, and through them the Apprentice Trust in supporting their work in getting people from sometimes disadvantaged backgrounds into NHS employment. So we're helping them target that. And we also work with the NHS supply chain. Obviously, between HEFMA and IHEAM, particularly IHEAM, have a huge proportion of their membership comes from the commercial supply chain that supports the NHS, including some of the big FM providers. So we're working with everybody that we can on this. Next slide, please, Gemma. So as I said, IHEAM and HEFMA some time ago now started developing our long-term strategies. We both obviously have our own strategies for the associations. We're different organisations and we have different structures and different aims, but we both recognised a long while back that workforce was probably our #1 aim. So we started to work on this strategy a little while ago. Workforce was the #1 area we wanted to work together on, although we do work on other areas as well. We recognise we have this mutual common connection by, through our membership. We share the same membership. HEFMA's membership is predominantly NHS organisations. IHEAM's is more on an individual basis, but covers many of the staff working in the NHS, and a great many of us, like myself included, are members of both HEFMA and IHEAM. And of course, the HCA and AHCP come into that role as well. We noted particularly that we wanted our strategy to dovetail in with the national agenda, and I think everything that Prainer has said this morning chimes completely with what we have set out in ours. And we noticed as well over this last sort of terrible year of COVID-19 that one of the oddities of it is there have been some sort of benefits that have come out of it, and I think one of the things we noted was there is a significant improvement in the recognition of the estates and facilities services as a result of the work we did with COVID. Prainer has just mentioned the work on the Nightingale hospitals, but also on the importance of cleaning, the importance of the reconfiguration of hospitals to take account of the additional capacity we needed to deal with COVID. All of those things got into the common language. We were recognised much more in the national media as well, and we think this is a great opportunity for us to take that positive public recognition and run with it, basically. Next slide, please, Gemma. So in the strategy, which hopefully many of you will have seen, we identified 7 key objectives that we were going to set out to do. The first one was to influence and support the national workforce strategy. Prainer's talked about the people strategy, but we know NHS E&I Estates Facilities team are developing some specific strategic elements for our team, for the team of EFM staff, to address recruitment, retention, diversity, and appropriate pay structures across healthcare EFM services, and also to develop model structures for healthcare organisations. I think that's key to sort of helping everyone do similarly and not fall into the pitfalls of individual trust problems. Secondly, was to drive a campaign to change the traditional perception of the NHS workforce as being predominantly made up of doctors and nurses to one that has a better awareness of the importance and diversity of job roles in the EFM professions. I think what I was just saying about the COVID recognition, I think people have recognised that whilst doctors and nurses provide principally the care to the patient, without estates and facilities services, very few of them would be able to operate, and I think that really came out during the crisis. We wanted to develop resources to market healthcare AFM services as a career of choice across all sectors of society and drive diversity, inclusion and representation in healthcare organisations. Next slide, please, Gemma. We aim to support and influence the creation of a national apprenticeship structure and training programme for all professional groups in healthcare EFM services. This is an area that we know has suffered a lot over many years. A great many of us that are still working in NHS services now or representing them started out in their careers as apprentices. The modern apprentice structures, which Pete will talk about, I'm sure, very shortly, really do cover the whole age range and the whole professional range. So it's vital that we begin to push that as a resource for the future. Support the ongoing development of a comprehensive career route map, which Jeff and Manira will be talking about in their session this afternoon, to inform potential employees, recruiters and existing staff of the employment and career advancement opportunities in healthcare EFM services. This is vital to get that understanding out there of what we do as EFM to attract people in, but also to provide people with a tool to develop their own careers that are already working within the NHS. We want to provide opportunities for education, training and knowledge sharing for members to develop their skills and experience across the requirements of their job roles and support and enable them to make the most of their career development opportunities. Next slide, please, Gemma. And last but by no means least was to develop explore ways that we can get our membership to develop personal resilience, mindfulness, well-being and mutual support to protect them from the pressures of working life. And that was, I think, Praina's last point, and a particularly pertinent one after the last year we've had. You will have seen a great amount of resources come round. We've done our very best to publicise everything that Praina has pushed out, and we hope to continue to do that as well, to ensure that you are all able to support yourselves and your colleagues in your work that can often be very, very stressful. Next slide, please, Gemma. The strategy developed around 4 key focus areas that I'm just going to quickly talk about. They're all supported by the objectives. So visibility, particularly, visibility and awareness about the EFM workforce amongst school leavers, we know is very vague. There's a lack of information out there about the career opportunities in the NHS and in the wider healthcare EFM services, and we need to make that much more available. This also emphasises the importance of promoting STEM subjects in education, which brings a lot of people into particularly the hard FM areas, but all of those areas that we support. We need to encourage more uptake in school subjects that can lead to EFM professions. Whilst this appears to be an improving picture from recent reports, there needs to be more activity to raise awareness of the successful career paths that these subjects can lead to. IHEM's work on the Faraday Challenge is a fantastic example of what we can do to support this initiative, and again, I'm sure Pete will talk about this a bit more very shortly. And the interactive career route map, which I mentioned earlier and we'll keep mentioning throughout the day, will also help in this process by highlighting the progression available within the industry in an easy to interpret format for people who don't know the vagaries of the NHS and our terminology. We're developing campaigns to change the traditional perception of the EFM profession, as I mentioned, away from that focus on clinical roles by highlighting the opportunities available in estates and facilities professions. This has to start with getting young people into the professions to produce the next generation of EFM professionals and leaders. We'll raise awareness of the importance and the variety of job roles within EFM through the production of media resources such as informative graphics, videos and particularly case studies. The process retention and remuneration focus area, as set out in the long-term plan and the NHS People Plan, The NHS must lead the way in valuing, caring for, listening to and educating and rewarding its people. We know there are a number of difficulties in recruiting EFM staff via traditional healthcare recruitment methods. These can be often long-winded and cumbersome and may not lend themselves well to those applying for jobs in their second language, those with lower educational attainments, or those with different abilities. The processes can also be overly long, which substantially undermines the agility of the service to recruit and potentially drives away those needing more immediate paid employment. Retention is also a key challenge for several reasons. Whilst the NHS has generally always been regarded as a good employer, I think, with regard to terms and conditions particularly, we know that some pay grades and lack of recognition in job roles and a scarcity of career development opportunities can lead to attrition of staff numbers. We need to ensure salary structures remain relevant and competitive to support recruitment and retention. This is an area we'll be applying our influence to over the course of this strategy to try and effect some change. It's therefore vitally important to set clear career pathways and development opportunities for those already working in the sector, as well as making these opportunities more attractive to a wider demographic, which is again where the use of the career route map we're developing will come in. In this aspect of the strategy, we're also aware that the development of wholly owned subsidiaries over recent years has highlighted the benefits that can be made to recruitment and retention by adopting more locally focused and competitive processes. Whilst this may not be the route that many organisations will go, we need to ensure that we capture best practice in this area of workforce and ensure that where it exists, we share it with all those that can affect constructive change. So we're perfectly placed to do that as membership organisations, to get this out to our members and encourage development of practices where they're permitted. In terms of development, this is a challenging time for the healthcare EFM sector. There is a culture of constant change in the NHS, as we all know, with substantial capital investment into the estate and further development of local healthcare structures going on as we speak. Many organisations are struggling with huge deficits in the quality of their environments and struggling with low staff numbers and in some cases skill levels. The strategy we've developed aims to support individuals at every level of their careers, from young people and apprentices starting out on their healthcare EFM journey to directors of estates and facilities and all roles in between. We'll provide opportunities wherever we can to ensure all EFM can develop their skills and experience across their service, access training to enable them to prepare for the next steps in their careers, and ensure they're able to maintain their professional recognition in their field. Diversity is one of those key areas, as Prana mentioned, where the NHS, like many organisations across the country, is not doing as well as it could. We recognise that an important first step in creating an inclusive culture is to understand why diversity and inclusion are beneficial across the EFM workforce. Addressing this issue will not only help bridge the skills gap, but it will also help drive innovation and creativity. As the UK's leading healthcare professional bodies representing the EFM workforce, we know it's our responsibility to raise awareness, inform and educate our members on this essential aspect of the workforce. And we do that in strong support, of course, of the NHS leadership in itself. We need to raise public awareness of the key roles of the EFM professions within healthcare, and riding on that wave of public support that I mentioned that we gained through the pandemic. We're enabling sustainable development of the workforce to encourage more diverse people to join the professions. We'll continue to provide resources and professional guidance alongside practical and technical advice to inform our members of the value of inclusive cultures across the healthcare sector. By informing our members and identifying barriers, we're ensuring there are actions and recommendations on diversity and inclusion in place, with clear articulation of the importance of an inclusive EFM workforce that works for everybody. We need to educate and to educate our members. We have interaction between diversity and inclusion champions, majority allies, leaders of professions, fellows, and the wider profession through training and events to share knowledge and best practice on diversity and inclusion. Both organisations have an ongoing commitment to support, develop and raise awareness of diversity and inclusion within our own communities and within the EFM community across the NHS. We're working towards providing members with support to develop their personal resilience, mindfulness, well-being, as I've mentioned, and to build an inclusive culture in the workplace. We'll continue to develop and share resources to enrich EFM services as a career of choice across all sectors of society and drive diversity, inclusion and representation within the healthcare organisations. Next slide, please, Gemma. So going forwards, we will continue developing the deliverable initiatives we've identified so far, and that Pete and the rest of our colleagues throughout the day will be talking about. We'll continue to look for more willing partners. We know that we can do more together, as I said at the beginning, and there are partners out there we know that wish to work with us. We will continue to support the development of NHS strategies and plans wherever we can. Everything we do is all heading in the same direction, so we're very, very keen to be part of the bigger agenda. We will continue to invest in these initiatives where we can. Obviously, this last few months has been difficult for all organisations, and HEFMA and IHEM are not immune to having had our income impacted upon, but we will, wherever we can, apply focused investment into these areas. And we will also seek out appropriate commercial partners to support the progress of the strategy as well. We know there are a number of organisations out there that are keen to work with us, that have an ability to provide resources to us that we can't perhaps provide. So we're very, very welcome to anybody joining us in that. Next slide, please, Gemma, which I think is the last one. So just really to reiterate our commitment, for this strategy that we've developed together, we are absolutely committed to this. We'll work with anybody that will help us deliver this strategy. We want to grow and sustain the estates and facilities workforce into the future. We want many people to share in the fantastic work that the NHS and the wider healthcare sector does. Many of us have had long-term careers in the NHS, and we know we can recommend it as a fantastic place to work. We're committed to use all of our available resources to drive improvement in these key areas, and we really, really hope that this strategy will make a big difference to the NHS, to social care, and to all of our commercial partners that work in supporting the NHS to drive patient care. So with that, I'm going to hand over to Pete, who's going to talk a little bit about some of the practical initiatives that are already underway, and you'll hear more about some of them during the course of the day as well. So over to you, Pete.
Thank you, Jonathan. And just to reinforce what Jonathan's just said there, IHEM's journey and EFMA's journey to support the workforce started many years ago. But actually, in the last few years, we've recognised that it is the number one area which glues both our organisations together. And in terms of IHEM, I think we set the vision. In our vision kind of document for the future, we highlighted we wanted to provide more to our members, not just the members, but also our affiliate members. And I think that came to light really when we launched our 5-year business plan back at the start of 2020, January 2020. And it's that I just want to kind of drill into now and just share with you the progress we've really made over the last 12 months. It's outstanding from my perspective, and it's credit to our partners, and as well as actually the very small team we have at IHEM who are just tirelessly working away on this agenda. So you all know who I mean when I say thank you to everybody who's supporting us. So yeah, I'm just going to cover the journey to date, highlight our new partners. We've got some really exciting news this morning, and set the kind of scene for where our priorities are going to be over the next 12 months. So if you could move on to the first slide, please, Gemma. The very first thing we had to do at IEM was really develop our infrastructure to be able to deal with this agenda we'd set. We'd set ourselves a use challenge, but centre to that challenge was the fact that we needed to modernise our IT and our website and rethink our complete strategy and how we engage with people. And a massive thank you to IEM's council, because they supported us in that investment, huge amount of investment. If you look at our website now, we turned that on in, I think it was October of last year, and you'll see some significant changes. The very first thing we was committed to do was develop a CPD system, which enables all our members to be able to easily capture their CPD. And this is important, actually. It's a requirement of the Engineering Council. It's going to be mandated. It's actually mandated now, but we wanted to make it simpler, and massive piece of work undertaken by Tanya with support from our members. We've simplified that process. It's automated. It will link to our webinars in the future with barcode technology to enable all our members to easily record their CPD, but also share it with other organisations if they need, and indeed in their workplaces. But central also to the website was our desire to create a learning hub and a knowledge hub. The knowledge hub it's all there, it's up and running, it's being built on through our technical platforms on a weekly basis as we're updating IEM's thoughts around guidance in terms of helping our people in terms of the practitioners' support in the system. But also we've got an international portal of healthcare documentation and guidance, which has been put together from across the world, and it's available to all our members free of charge. So please use it. You can look at guidance and standards from around the world that will help you make choices here in the work you do in your day-to-day activities, both in the public and private sector of health. Part of what we did as well, and I'm not going to spend too much time on it, but it was part of developing our own governance within the Institute. There's a complete new governance package, and we operate, and training has been provided to all our council members and key committee members. And it's all part of our commitment to support and develop our staff, regardless of where they fit in the system, whether they are apprentices, whether the people coming into the service, or whether the people very senior in their roles. Could you please move on to the next slide, please, Gemma? I mentioned earlier the Learning Hub, and I'm delighted that actually today we can formally announce for the very first time a tremendous amount of partners who have come on board with IEM to deliver targeted training to our members at all levels, and in some cases very specialist training, as well as kind of general support in their career. And this is something we kind of took very serious from the start of this year, and you can see that we've got 8 or so partners in place. Today, if you check our website out, there is upwards of 80 to 90 dedicated training programs which are now being provided to our members across this wide spectrum of estates and facilities management. But particularly one I want to just mention first is at the top of that list is I'm delighted that, and you'll hear later from Wayne and the team up in the northeast, that actually we're now at that final stage where we will be launching the very first healthcare engineering specialist apprentice program for NHS staff, not just for NHS staff, by the way. Our colleagues in the private sector providing these services to the NHS are more than welcome to also use that course. So we're delighted that 3 years, probably maybe 4 years of work really led and developed by our colleagues up in the north. People will know that that program's been around for 40 plus years, but we've now got the structure in place for this to be rolled out to the entire country. We're absolutely delighted. It's a fantastic step forward, and as Jonathan said earlier, our aim between EFMA and IEM is to also pick up what we know about those, how to develop those programs now, and start to develop further programs to support that wider spectrum of EFM staff. Toppy was our first partner. We launched that in the summer, but again, this is an opportunity for our people to get involved, have some proper targeted training around healthcare estates and facilities planning. It's an accredited course. We've already had upwards of 30 of IE members being through it, and we want this as something both EFMA and IEM are really wanting to give traction to enable our people really to be able to see how healthcare planning is delivered from an international perspective and come away with an accreditation for the work they've done. Asset Wisdom, very successful, and thanks to June Lancaster, who we've known for many years and worked at the front of the NHS as a nurse. But this is about looking at assets, but looking at it differently. And the fantastic courses which are being offered, and again, we've already had 15, 20 NHS people signing up to these courses. And it's really looking at that whole aspect of asset management, but recognizing though that assets are managed differently in different areas, you know, the air industry, rail industry, nuclear industry. But of course, health has to manage its assets, but there are things we can learn from other industries. And part of that link to Asset Wisdom, and it is also our link to the Institute of Asset Management, where we're now looking at a partnership to share that whole work, that ethos of how better to manage assets. Eastwood Park, you all know about Eastwood Park. We've all been there many, many years ago, and we have our accredited frameworks and training down at Eastwood Park, particularly on the decontamination. And we are discussing with Eastwood Park about future opportunities. ETA, there's a suite of courses there aimed more around electrical training, aimed for APs and CPs, and really great set of courses. They're kind of structured to be delivered online, so we've got that ability to support people whether they want training face-to-face, online, and I think going forward it will be a mixture of both, and it provides a great choice. Everybody will have heard of Spivot Sarco. They're providing upwards of 8 specialist training courses all around steam, boiler management, the things Spivot Sarco's been #1 for the last 40, 50 years to my knowledge. Dudley College of Technology, and thank you to our West Midlands branch actually for the introduction, Phil Wade in particular. We're just literally finalising a partnership, and very shortly there'll be opportunities to enter in courses down at Dudley, but these are focused at medical engineering. So this is our support to our medical engineering fraternity within EFM, which we need to grow. It's an area I think has been unfortunately forgot about over the years, but we're really committed at the Institute to bring that that group of people, you know, to the front of our work. They're very important, and Dudley College of Technology recognise that, and they will be putting on dedicated training courses for medical engineers in partnership with the Institute. BESA, our colleagues at BESA do a tremendous amount of work with our supply chain, and also link and support a lot of trusts, not just here in England, but in our devolved nations as well. And I'm delighted that we've formalised an agreement with BISA or SFG20. Some of you will know about it, but it's a suite of softwares, programs to help you kind of do your planned maintenance, monitor your systems. They keep it up to date. It's a fantastic product. But the message today is that our affiliated trusts in the NHS can get access to that software at a massively reduced cost from £6,000 down to £1,000. Our private sector colleagues will also get discounts, which hopefully will make this kind of support to the system affordable and available. So thank you to BISA to working with us on that. The bottom of the screen there is PPL training, and along with Heathwood Park is probably one of the biggest training providers here in the NHS. And this morning, overnight, so I have to say it's a massive thank you to my team. They've been working tirelessly to get all this information up on the website ready for today. But there was upwards of 70 dedicated training programs for estates and facilities people in partnership with PPL training. So we think this is fantastic. It's the start of where we want to be. We're in discussions with a number of universities around how we can look at specific training to support, at master's level into engineering, and as well as areas like healthcare planning. So I think there'll be more to come, but I'm just delighted that from the start of this year to where we are now, that there's upwards of 80 to 90 dedicated programs there for our members to start to be able to engage with and use. And what's integral to that, Jonathan mentioned it earlier, and it will be covered later by Jeff and Manira, is the work we've done on the career path. The career path, which is online, is interactive. It gives you an overview of the roles, as Jonathan said earlier, but starts to put the job descriptions behind it, starts to put potential salaries. But more importantly, we will start to identify the training, the development you need to progress through your careers. And the reason why this partnership is so crucial is because we will link at all stages of that career map where the support is already there to help you to grow and develop. And if we feel there's gaps, and there will be gaps, we want to be looking to see how we can plug those gaps going forward. So the next slide, please, Gemma. So where do we go next? And there's a whole thing around mentoring and coaching, and we've already started that, and we did a very kind of brief call for people within IEM who wanted to get involved in mentoring and coaching, and I think we had over 80 requests, and thanks to Tanya, we've started to deliver some of that coaching and support to IEM members. We want to actually build on this, and the reason we want to build on this is because some of the areas we want to kind of move to next is how we can support people get to professional status in their careers. So how do they get to CEng, IEng, and recognize that the traditional route is through having an appropriate qualification at university or college, and obviously supported by your by the experience and knowledge in your post, gives you the right to apply for chartered engineer status, for example. However, we have to recognize that there is, as Jonathan said earlier, and everybody alludes to, there is a shortage. And we've talked about this shortage for many, many years, but it is happening. But what we have in the system are very good people who have probably been doing the job for many, many, many years, in some cases decades, but they haven't had the fortunate opportunity to be supported to go and get a master's degree at university or whatever. But there is routes and accredited routes to become chartered and professionally qualified. One of them is called non-standard route, which is basically it's a case study to demonstrate your kind of professional and expertise and knowledge. It's pretty difficult to get through that. There's only around about 1 in 4 succeed, and there is another route which we've been exploring with the Engineering Council, which is called the Experiential Route, and we want to put together this package. And this is really around people being able to use their experience as part of the process to gain chartered engineer status. To make all that happen, we need a really good group of qualified, trained assessors, coaches, and people who can support people on that journey. And so the whole mentoring and coaching agenda we've started, we need to build on, and we need the investment to make that happen. And we've started that journey, but we could, we really need to look at other sources of income to bring it to life. If all that comes to life, then what we can provide as a professional body, but also supported by colleagues in EFMA, as Jonathan said, there's lots of crossovers between our members. We can actually collectively support the future leaders to come through, and who haven't probably had the benefit to be able to go and do a master's degree, who have probably got the skills and the knowledge and the experience with some proper guided support to get them through that journey. It's a huge agenda. We started that, and we really need support of our members and others to help us to get through that journey. And part of that, by the way, on the third bullet point is, as the apprentice program starts to roll out, and as I said, Wayne will speak about this more, we also looking to provide assessors from our fraternity within the NHS as part of that national program. And what better way to do it, with the knowledge and the experience of the people we have in both EFMA and IEM, to train them to support that rollout of that apprentice program. So the big agendas, the ambitious agendas, but you know what, I think collectively we can actually deliver on these. The other area is the STEM, and we'd started that work some time ago, and Manira, I think, will talk a bit about this later this afternoon. And it's just a fantastic piece of work engaging with youngsters. Our Paul's on the call today. Paul, as president of IEM, this is one of his kind of main challenges, and it's a fantastic piece of work, and it's called the Iet Family Challenge. If you don't know about it, have a look online. It's normally supported by big, stock market kind of top 100 companies, Airbus. These big industries are usually behind the Faraday Challenge. We're delighted that IEM is actually going to sponsor that challenge, which starts, I think it's September of this year, and will run for a full year. That challenge is, we get to set that challenge, and we will be sharing the details on the specific challenge in the near future. We're not allowed to actually say what the challenge is, because this year's challenge is still underway. But it will be healthcare and it will be engineering. But what's important about this goes out to schools around the country. It's supported on a national program. It's getting school kids to start to think about engineering. Given what's gone off with COVID last year, healthcare is at the top of most people's agenda at this moment in time. And we just think it's a fantastic opportunity to engage with kids at school on engineering, which will hopefully be to the betterment of healthcare engineering. We will need some support on that. So, a call to branches, a call to IEM and EFMA members. we will want people to represent us at schools when this program kicks off. It's a fantastic piece of work, and you know, we're so looking forward to it. We do need to get some sponsorship in, but that's something we'll be looking to hopefully get sponsorship to help us deliver it. It's a huge cost to the institute, but we're committed to doing it, and we will do it. And the next one is the launch of our Young Members Scheme. More will come out with this. This is following on, again, linked to the STEM, linked to the Faraday Challenge, but we are committed to creating a young members membership at IEAM. It will be, again, an investment for the Institute in terms of how we manage it and how we put it together, but clearly we want to do it. So there will be a young members membership appearing later in the year. Gemma, who's actually behind the scenes looking after this event this morning, is leading that work for us. We're already talking to youngsters, and we want those youngsters to form a group, their own kind of committee, and we want to give them a voice at IEAM's National Council. And it's part of our engagement that, you know, we have to recognise that the future leaders are the people who probably, don't take this the wrong way, are on the line today. It's the people we need who aren't on the line today to attract them to our industry. So I'm delighted that this piece of work's underway, and just stick with us and watch what comes out. And finally, just really to say, the career route map, which I've spoke about briefly, is core and centre to this, and there'll be a huge amount of work taking place with EFMA and IEAM as we continue to develop that route map, really to support our members. And I just want to say, when we talk about supporting our members, it's our companies as well. And I think that's an area we want to really start to consider how and what we can do to support our company members as we move forward as well. So thank you. I think that's my final slide. So I'm going to hand it over to Paul. Back to Paul.
That's great. Thanks, Pete. Thanks, Jonathan. So many thanks to Prerna for her opening keynote discussion, and also to Jonathan and Pete for the launch of the workforce strategy and putting some national policy perspective and around all of this. We've got a number of questions that have come in, but if you have any questions for our speakers, then if I could ask you to post them in the questions function. While you're doing that, please also remember to visit the HEFMA or IHEAM websites, or indeed the NHSCI collaboration hub for regular updates around all of this that you have seen today. I think it's also prudent to mention, as I did before, today being Global FM Day, and celebrating FM beyond the pandemic. And it's really interesting, if you look certainly at HEFMA or indeed LinkedIn, that also today is International Nurses Day. And there's a huge amount of publicity around International Nurses Day, quite rightly, but actually somewhat biased to our professional EFM. I know very little actually on Twitter around Global FM Day. So really, really interesting. And I think probably just heightens the discussion, awareness around increasing awareness of the EFM profession and all of the stuff. I've been quite vocal on Twitter and others around and other platforms around how the EFM profession has stood side by side, shoulder to shoulder with our medical clinical colleagues through the fight against COVID over the last 12 to 15 months. The changes that we've had to make to the estate, the cleaning regimes we've had to put in, and all that we've had to do. I am incredibly proud of our estates and facilities profession, and I hope certainly that the strategy which you have seen today will hold us now in good stead to both make EFM more visible and to encourage those into the profession, and indeed develop those who are already in the profession. So without further ado, Pete, Jonathan, if I may, I'll go to the questions. The first question we've got is from Lisa Grandcourt, and it says, are there plans for EFM ambassadors to go into schools or colleges to inform students of their career choices in the NHS? I think you picked it up earlier with the Faraday Challenge, Pete. And I know Monera is joining Jeff Neild and Wayne and others later in the day in the last session, which is around apprentices. But can I just go to you first, Pete, to give us a little bit of background about what we're doing here on STEM, and then I'll come across to you, Jonathan.
Yeah, Paul, and a great question, by the way. Just before the pandemic kicked in last year, Monera, with our colleagues in the Northeast, we had a week's event up there where we visited quite a number of schools. Unfortunately, pandemics got in the way. We couldn't continue to do what our plans was at the start of last year. But what was interesting for me is that our estates directors and colleagues and apprentices joined that program along with Monera. They went around schools and they spoke to them in terms of career days and opportunities. But the feedback we got was the thing what really gave me kind of encouragement. That second only to the army was healthcare, engineering and estate management. So that says to me that if we can get our messages right, we can get a pool of ambassadors, we can get people trained and supported, then actually, if we can get those messages to the youngsters earlier, then there is an opportunity. I think we can attract youngsters into our not just healthcare, but also into engineering and estate management. So the encouraging sign was only after the army and the toys they had to play with, if you know what I mean. But we've got toys, and it's something we've spoke about, that maybe we don't have the funds, we don't have the investment, but we'd like to try to do our own video and recognizing all the stuff our people do. We may not have planes or tanks, but we have big equipment going into specialist areas. Lots of kind of toys in a different way, engineering and construction toys, which I think if we can put together as a package, will help support that agenda. So yes, it's a call as we move forward on this agenda through HEFMA's branches and through IEM's branches. We are seeking volunteers to help us on this journey.
Thanks, Pete. And Jonathan.
Yeah, I think it's an excellent opportunity. I'm aware that informally there are a number of people that do volunteer to do this in their local communities, and I think it always has to be something that people do locally. It's not something we've got any formal structure around, to the best of my knowledge, and I think it is something we do need to focus on. This is all about this visibility of the professions, and if we don't make them visible to the young people whilst they're in education, they're not going to know about it when they come out of education. So I think now is the perfect time. A lot more people know about us because of what happened over the last year, and the fact that the media did eventually get on board with it and recognise that there are a lot of people cleaning around all of the ICU nurses that we saw on the television so regularly. So I think we've got this springboard, as I mentioned in my presentation, to sort of jump off from. I think we also need to reflect on how best to engage with that process, and I often wonder how engaged a group of teenagers at school would be with an old fossil like me standing at the front of their hall talking to them about my career or what careers there are. I know that people like Monera, young people like her, going into schools, I think get a much better engagement. But I think there's been some fantastic videos produced in recent times I know we published one on our website, and I think it's on IHEM's website as well, from Leeds teaching hospitals, which was just a simple video showing a number of different people working in estates and facilities on their site, all of the range of things they did interspersed with a lot of statistics. And I think that was a fantastic piece of work. I don't imagine it cost a huge amount of money, although it was very professionally done. And perhaps that's something that IHEM and HEFMA can do to begin to get some electronic resources out there, something that perhaps people might engage with through YouTube or whatever the other current flavour of the month video platforms are. But maybe look at different ways of engaging the young people rather than standing in school halls talking to them. But I do think that's one of the first things we've got to set about doing, is engaging with the people that are going to be working here in another 10 years' time, when some of the rest of us might not be.
Thanks, Jonathan. Thanks, Pete. Yeah, I absolutely agree. And speaking as a fellow old fossil, I think it's really important around that engagement level, and having the tools that we're able to get into schools with that sort of link about those various platforms, which quite frankly are alien to me. I just about manage Twitter and LinkedIn. Don't ask me about any of the others, but and it's really important we use that platform, I think. It's just sort of looking, I think, as well at the way of which that interaction takes place. I do sense there's a greater inquiry through the post-COVID world of the work that the NHS does in all its functions. We have, certainly speaking for my own trust, we've certainly seen a greater inquiry level around the vacancies that we'll put out within the states and facilities, particularly from younger generations. So I keep my fingers crossed that we're going in the right direction. Just so many thanks for that question, Lisa. You also did pose a question with regards to, could you share a link with us where we can access more information on the courses that Pete was talking about through our partners. Melissa has put that in the chat, but it's www.ihem.org.uk/learning-hub/training courses. Go to the IHEM website or the HEFMA website. I'm sure those two will talk and you'll get the answer you need. Got a question from James Chadwick, and one that follows on from that, from Catherine Senior. So I'll just start with James' question first, which is great news around the apprenticeship courses. And this may well be a question that you may want to ask James if you're joining us in the session at the end of the day with Wayne and Jeff and others. But you've asked, how will we get access to the schemes for apprentices dependent upon geographical location? And then the follow-up question, but linked to that, from Catherine, is what level is the healthcare engineering apprenticeship? Pete, if I can come to you first, and then we'll go to Jonathan.
Yeah, in terms of access, we're working closely with NHS Salisbury, and they will be going out to procurement for providers based upon the course, which has got government approval, so it's fully backed by the apprenticeship levy. And what we're looking for is a complete geographic coverage of that training throughout England. And I'm not sure how it will work. There could be one provider providing geographically, or it could be one provider with a number of providers underneath them working in a geographic location. So we're not exactly sure how it will work, but obviously the intention is to give it a national coverage. So James, just stick with us. Hopefully when you hear from Simon Dennis this afternoon and Wayne, that they might be able to provide a little bit more detail on that timeline, but it is very, very imminent.
Than's Pete. And Jonathan?
Was there a second part of the question? Sorry, Paul.
Yeah, there was. What level is the healthcare engineering apprenticeship?
I'm not going to guess. I might get it wrong, so I'm going to let Wayne deal with that this afternoon, and it also makes sure James has to log into that session as well.
Good stuff. Nice ploy as well. Thanks, Jonathan.
Yeah, I think it's, as Pete says, this is a work in progress. It's moving at a heck of a pace, and it's sort of, you know, that particular apprenticeship is about ready to go. So you know, the announcements of some of the more details will be this afternoon, but it is sort of still a work in progress. I think what I want to say as well is that this is obviously a healthcare engineering apprenticeship. Our aim through the strategy is to develop apprenticeships that are available, to make apprenticeships available for all professional areas. So the whole of EFM is represented. You know, I know that the Association for Healthcare Cleaning Professionals developed an apprenticeship for cleaning professionals with the appropriate training package a couple of years ago, and that is available nationally. And now we know, because the work we've been doing with Salisbury, we've identified that's actually out there as well. So it's not necessarily about us providing the apprenticeships, it's ensuring they're there, and where they're not there, finding ways of getting them to market, as it were. So I think in the wider sense, we're you know, it's one scope of the work to get apprenticeships out there. And of course, these aren't just about school leavers, these are all ages and all professions. So they're an essential part of career development that people can adopt throughout the process. But it's a big task, and it will take a little while, I think, to roll them all out fully.
And Paul, if I may, just to, as Tanya will not forgive me, because Tanya is working very closely with the Engineering Council. So actually, with people coming through that course, it will be the first start of their professional registration to the Engineering Council, will be a guaranteed component of completing that course.
Okay, thanks Pete, thanks Jonathan. And in fact, Tanya has put it's a level 3 actually.
Oh, thank you, Tanya.
So James, you now know, but there'll still be no excuse for not logging into this afternoon session, because you'll find a lot more information out on that. A couple of questions from George Walsh, who says, was the role of compliance managers within the NHS considered during the scoping exercise, and will there be training mapped out for a compliance manager role? Jonathan, if I can go to you first.
Certainly in our assessment of the standard roles I mentioned, the sort of 90 odd standard roles we identified, we were doing a piece of work for Health Education England around that, and trying to identify what is the range of estates and facility services, and compliance managers, risk managers, those type of roles was definitely included in that. You know, again, there's a huge amount of work. We've only really sort of relatively recently started on all of this, so there's a lot of work to do to get us to a point of identifying training packages or specific qualifications for those sort of areas. But they'll certainly be reflected in the career route map over time. Again, that is a work in progress, but they will certainly be included in that going forward. So I suspect that probably doesn't entirely answer George's question, but it's sort of again, much as with much of this, it is something we are working on, but they are very much in our sights.
Thanks, Jonathan. Yeah, and certainly I think, you know, the strategy sort of forward certainly makes reference to the fact that the complexity of the number of roles in estates and facilities management, you know, are wide and varied. And actually, I think, you know, we mentioned in there, don't we, in the introduction, that actually, whilst we've got the stats that you mentioned earlier, actually, there's an awful lot of other stuff that comes FM's way, which may not fit into the standard, if you like, job description or roles of some individuals. So I think that's really important. So George, we will keep you updated on that. But as I say, I think compliance manager and many other roles, I think, will be taken into this work. Pete, I don't know if you've got anything else to add to that. If not, I'll sort of move on to the next question, if I may. And this one is directly to Pete, and that comes from Matthew Leeming, which is, would IHEAM have plans to implement professional registration advisors?
Professional registration advisors, I'm not quite sure I understand the question. We certainly got plans, and we're underway regards holding a professional register for all the specialist services, but I'm not quite sure I've understood the question, Paul.
Okay, thanks, Matthew. If you're with us, if you could probably just add a little more to that question, that would be great. And we'll see where we can go with that. If not, then if you want to contact us, and we can provide you some further information therefore. But hopefully you'll come back with some further detail around what you're asking there. Question again from James Chadwick, and I think this is topical. This is very topical at our trust at the moment, James. So we find, James says, we find there is a lot of discrepancy between pay internal to the NHSI, and external private sector companies. Although we have proof of not being able to recruit skilled trade staff, the trust stance is still not to support RRP, retention, recruitment, protection, or pay uplift, mainly FM driven. And as we're not clinically categorised, is this something that the partnership with NHSEI may be able to help with? The NHS is meant to be about equality, but the scales are set from the top. Really, really interesting debate, one which I think will be for us for many years, quite frankly, and that is I'm going to be bold and say it's a fudge, the RRP. Going back to the Agenda for Change back in 2003-04, when it started to come with us, there was, it was heavily clinically focused, and therefore there was a bit of a fudge in bringing RRP for those roles, band 4, band 5 tradesmen. I've certainly borne the battle scars with my guys at the sort of 2 or 3 trusts that I've been with in recent times around all that. But again, it may well be a question of our NHSEI colleagues in future discussions. But Pete, I don't know if you can just sort of touch on this.
Yeah, well, again, I think it's a very appropriate question. And as you was asking the question, I'm just thinking through it, and I think the work we're doing around raising the profile and the importance of estates and facilities staff, linking it to the career map, linking it to the JDs, and all that starts to provide the evidence for discussions in terms of the pay bands and the pay grades. I think clearly as a professional body, that's outside our control, but we'd be more than helpful to, we'd be more than willing to work with NHSI colleagues if they want to make that case in terms of the policy around the pay in this area. And I think both EFMA and IEM would certainly, provide the evidence, the support, the case studies, anything needed to help on that agenda. But I also think the work we've started, and I've got our career map on my screen just flashing around with all the different roles. I'm looking for that compliance manager just to see if it kind of comes up on the screen. But I think this provides a fantastic evidence base for people to make that case, and we're more than happy to help with that national agenda if we're asked to do so.
Okay, thanks, Pete. And I know, Jonathan, you also bear some of those battle scars.
Indeed, yes, and I think there's probably a number of discrepancies people would identify across the whole Agenda for Change pay structure. I think most of us recognise it's not perfect, and what pay structure ever is, but it's probably overdue a review, I think some of us would suggest. I think in answer to James's question, I think we need to be clear on what our remits are. I mean, clearly, Agenda for Change and all of those sort of pay quirks that we all battle with from time to time is in the ownership of the NHS. We can't say, we'll scrap this and change it for this. I think what we've said in the strategy is we will apply our influence, which is not insignificant, to change that. And as Pete says, the key thing we can do is gather that information, make those arguments. We know, the point I made about the wholly owned subsidiaries, whilst it's a contentious area in its own right, wholly owned subsidiaries, a number of them would argue that it's allowed them to step outside of some of those constraints that apply to other NHS bodies, and find more imaginative and constructive ways of recruiting and remunerating their staff. And I know from speaking to colleagues that several of them have been able to maintain their recruitment of particularly the estates tradesmen, which is this particularly the RRP particularly applies to, in a much more successful way to compete with local contract rates, which we know are in most cases higher. So I think there are ways of doing it, and I think the NHS is alive to the fact that it needs to possibly review this. As ever with these things, the wheels turn slowly, but I think we will continue to put the lever to the door to try and get that one changed. Because we recognise it's a bar to retaining good staff and recruiting them in the first place. When I think particularly as we now see the government's drive for recovery after COVID and after Brexit and everything else, that there is mooted lots of development work on building, engineering, development of science and technology. We're going to be competing in a much more vibrant pool of job roles potentially in the future, which is going to add to the burden we've got of trying to improve a lot of the NHS. So we'll do all we can to lever it, but we can't just change it, unfortunately.
Some really important points there. And I know, as you say, Jonathan, that the it's a contentious issue in some respects, particularly when you look at the some of those the steps have been taken. But I think at the end of the day, what we have to do is we have to react to the marketplace, and that will always be a challenging thing for the NHS. Pete, you wanted to come in?
Yeah, as you've been talking, I've just been scanning through our career map, and I can confirm there is a job title called Governance, Risk and Compliance Officer in there. There's a full JD, there's the NHS branding, typical salaries, and it sets out your qualifications and development you need to achieve it. So I just thought answer that earlier question. What I am looking at, of course, is, and maybe this is something to our partners in terms of qualifications and support, we'll obviously be looking to link it where there's some training in the system already available for people to follow if that is the route they're looking to do. And that's so I've got it up on screen. There's an unbelievable amount of information already being put in on that particular post.
Yeah, I would agree, and actually Monera has just popped that into on my screen with regards to we do have compliance governance roles within and contracting roles within the leadership and admin path of the career route maps. Right. So please take a look at that. We've had just so we've had a reply back from Matthew. Many thanks, Matthew. So Matthew has said, I know that IET hold a register of advisors that assist with engineers preparing to apply for iEng and CEng registration, such as the interview stage and forming development plans for failed applications. I know, Pete, that's something that you and I have talked about with regards to that route, particularly through the sort of the non-standard sort of approach to CEng, and making sure that we've got support for anyone who goes through the application process. So I don't know if there's anything else you wanted to add on that, but we do hold that register of advisors, Matthew, that will assist our applicant in that process.
Yes, we do, Paul, and it's linked to the kind of thing I discussed earlier, that we recognise that when we formally launch a programme to support people to go through the non-standard route or the experiential learning route, to bring that to life, we will need a pool of assessors and mentors and coaches to help people through that journey. And that links to the point I mentioned earlier, that we're now actively looking to put that support and training in place and identify people who want to to help on that journey. It's a win-win actually, because the people doing the work also get the development, and they're also helping colleagues that come through the system. So yes, we do have a register in place, and it's an area we're starting to get a backlog on in terms of needing that support.
Thanks, Pete, and yeah, absolutely agree. Again, what I would say for our attendees at today's sessions is that, you know, this is all about us within the profession making this happen. So if you are interested in assisting us through that process as being an advisor or helping others through the registration process, then please get in contact with IHEAM or HEFMA via the website or across to Jonathan, myself, and Pete or the team down in IHEAM head office. Really interested to hear from you. So I think we've got time for just one more question. We've had a few that have come in over the last sort of minute or so, couple of minutes. So one from Alison Edmondson, who says, are the career map suggested bands and typical salaries aligned to the NHS employers' role profiles which internal job matching panels use? Jonathan.
I would say yes, perhaps with ill-deserved confidence, but yes, I think they are. I think that's something that that Jeff and Manira, when they're talking about the career route map and how they've developed it this afternoon, we'll probably talk in a lot more detail. But yes, I mean, we've used within the career route map, we've used all of the intelligence we have available. I think there's always you know, a sort of an element of caution with these things. As we're developing it at pace, we're developing it to become a practical tool. We do need input to it. So if people spot things that they disagree with, or something missing that that they can add to, we will very much appreciate feedback on it as it goes live and becomes practically used. But my belief is that we've used all of the standard approach that we can. And I'm sure there will be roles on there that people will say, well, in my trust, this is not banded like this. But you know, this is the trouble with, you know, we've identified 90 potential standard roles, but NHSE and I had feedback from the service that there were upwards of 300. So, you know, everyone will call a role something different. Everyone will have it banded slightly. It will be amalgamated with other functions. It will be separated out into constituent parts. So I think it's difficult to come up with a standard. This is supposed to be a guide, but I think we've done everything. We are doing everything we can to make it, you know, defensible and compliant with the general profiles and standards that are out there.
Okay, that's great. Thanks, Jonathan. Actually, Melissa has put in the chat here that yes, they are, and we do have a disclaimer saying explaining the NHS agenda for change, and it can differ per trust. And again, if you join the session later, then Manira will go through all of that in detail with those attendees. So there's a couple of comments in the chat as well. I think there's one in particular around visits to schools, which again, certainly through the STEM agenda and the discussion at the next two sessions, but particularly Manira, I think will cover some attendance at schools to promote the estates and facilities profession. So our time is drawing to a close. I would just like to thank you all for attending this morning's session. A really important subject, something which is really close to my heart, and you can, I think, hear the passion in both Pete and Jonathan's voice around making this happen, pushing the estates and facilities profession, encouraging those into the profession, and indeed developing those who are already in the profession. So many thanks to Pranar Izar, the Chief People Officer for NHS England and NHS Improvement. Unfortunately, Pranar could not stay with us today, but if you have any questions at all that you want to send through to us, then please do. And we'll ensure that she gets them, and we will follow through on any responses. Thank you also to Jonathan Stewart, the HEFMA National Chairman, and also to Pete Sellers, the IHEAM Chief Executive Officer. And we thank you all for watching this webinar. Thank you very much and goodbye.